Hi guys, it's Aishwarya and welcome back to Assistive Insight. Today I'm talking with Kate about MMA syndrome, which is, and I'm sorry, it's I think Miserable Malalignment Syndrome. I kept wanting to say malignant because it's just screws me up. But yeah, so if you want to go ahead and start talking a little about what that is.
Sure. So miserable malalignment syndrome is when the bones in your legs are abnormally rotated. So in my case, that meant that my femurs pointed inwards and then my tibias went out. And that causes a lot of pain in the hips, the knees, sometimes the ankles. You can get pain in your lower back, your shoulders too, because you feel your legs are kind of crooked. So your whole body kind of feels crooked as well.
Right.
Yeah.
So when did you first start noticing this pain and how did it impact you at that point?
Well, I'm pretty sure I had pain most of my life, but I just didn't know any better. I thought it was totally normal. I think the first time that I thought something could be wrong, I was in middle school and I was on the track team and I had been running and my knee had been bothering me. So I definitely I mentioned it to my coach, but it didn't really go anywhere. It wasn't that big of a concern. And then it wasn't until I was in college that I really started to notice that my hips were bothering me.
Right.
At this point, I was still running. I've been running for most of my life. And again, I didn't know anything different from it. So I just thought it was normal, running leg pain. And then in college, my legs would hurt so bad that I would come home from a run and I would have my roommate help me kind of pop my hips back into place. It felt like I needed to pop it. So yeah, I definitely started seeking help at that point, but I didn't actually get my diagnosis of miserable malalignment until I was 27. There was another diagnosis before that. We thought it was labral tears and impingements in my hips that were the biggest issue. So
what does that mean?
So that means the head of the femur wasn't shaped correctly.
Okay.
So what the surgery involves is reshaping the head of the femur so it fits better in the socket because it's a ball and socket joint.
Right.
And then because it wasn't shaped correctly, it was tearing the cartilage that goes around the hip joint. So the surgery also fixed the labrum or the cartilage around the joint. So I had 3 of those surgeries before I even had my miserable malalignment diagnosis.
Okay, so was all of this going on when you were in college?
So the first surgery happened right out of college.
Oh, okay, I see.
It was, I think let's see. Yeah, it was within a matter of months, after I graduated, that this was happening. I was actually still in the middle of a clinical rotation because I'm an occupational therapist. So I walked for graduation, and then I had to finish my clinical rotation. And so as my hip joint was just getting worse and worse, I was working in a hospital and on my feet all day, even having to transfer patients, so helping them move from their bed to wheelchair or whatever. And yeah, my hip was just not having it. So then I did get the diagnosis of the impingements and then started with the surgeries.
Oh, I see. Okay. So as an occupational therapist, was that did that include working with physical therapy with other patients? So having done that and seeing all these different patients, the way physical therapy affects them, how did that affect your own recovery and how you saw what was wrong with your femur and all that? How did that affect that?
I mean, well, I guess I feel I can speak from an occupational therapy standpoint. And I don't know, first, I remember thinking when I was working with a patient specifically, a lot of them would tell me, oh, you don't know how I feel. You don't know what it's like to have hip problems, because a lot of them are total hip replacements.
Right.
And I in my head, I'm thinking, no, yes, I do. I know what it's like to have hip pain, but now I have a completely different perspective like having been on the other side of surgery and like some really intense surgeries too.
Right.
Yeah,
It's just like gives you a different perspective.
It's definitely, a different perspective. And I think too, like I'm also thankful that like I went the route of being an occupational therapist, and I have worked so closely with physical therapists too, because like I feel like I have a different like knowledge of it.
Right.
Like, you know, like most patients like go into these things like having no idea what to expect, or like how, like on the other side of surgery, how are they going to be able to get dressed again, like you know, whatever condition that they have.
Yeah.
Or like how they're going to be independent in certain things. But I mean, there's been times where I'm absolutely not independent like I want to be. Like I do have to rely on help, but I also like have the background knowledge of like, oh, this is like what I need to do to be able to get dressed after, you know.
Right. It gave you like a little advantage. Yeah.
Yeah. And then like same with physical therapy is like I've, you know, definitely learned a lot of things from them. Like, you know, like gait training, like learning how to walk again after surgery.
Yeah.
Yeah, it's a unique perspective, and I'm very thankful for it.
Yeah. So you mentioned that like you had a little trouble with doctors and like a surgery that went bad. So if you could just like elaborate a little on that, and maybe like, I know you work in healthcare, so how did that experience kind of like shape what you thought about the healthcare system? About how did it maybe affect how you worked as an occupational therapist?
Right. Well, so it was the first surgery that I had, and I mean, like I didn't really have any idea, like I didn't have anything to compare it to at that point. So I just kind of thought it might have been normal, but it wasn't until like a few weeks after the surgery I'm like, I don't think that went very well. But I think like my experience like before the surgery was like, you know, with the surgeon was really challenging because like I said, at that point I was like finishing my clinical rotation, and then like after you finish your rotation you normally sit for your occupational therapy boards. And so like I was kind of in like this weird like transition period when this was all happening, and the surgeon basically told me that if I had this surgery before I took my boards that I was going to fail. And I was like, oh, okay, like I don't understand. And then he explained, he's like, it's a very, you know, brutal surgery, like you're not going to want to study, like you're not going to feel well, you're going to be in pain and blah blah blah. And in my head I'm like, well, like I did not understand.
Yeah, right.
I mean, like I had an idea of like the timeline, like how I wanted things to go. Like I would have the surgery, I'd give myself a few weeks of, you know, just doing nothing.
Right.
And then I would take like the next like 2 months to study for the exam. Most people, well, I don't know this for sure, but I think a lot of people don't take a full 2 months, but I decided to do that because like I knew that I might need to like take more breaks than other people. Like I might be uncomfortable, I might be in pain, and I would just have to adjust. I had it all planned out. But he didn't think that was a very wise decision, and I went against like what he recommended, like because I didn't want to, you know, finish my rotation and then like take my boards and then go straight into surgery. Like I wanted to take my boards and go straight into the workforce. Like that was kind of my plan. So I wanted to get like the hard stuff behind me. And I also was like, I don't want to like suffer. Like the more I prolong this, like the more I'm going to suffer. I've already gone 20 30 years, like being in pain, and I just kind of wanted to get it over with.
Right.
And then after the surgery, like it was hard. Like I had like some trouble breathing, which I found out later that it was probably because like to do the surgery, you have to like dislocate the hip. And like I think maybe like my ribs or something got like bruised in surgery or something. Like it was gnarly. And then I had a lot of bleeding afterwards too. But I mean, it wasn't until a few years later when I had the neck surgery with a different surgeon, like the same procedure, but like with a different surgeon, that I realized the difference.
Right. Did you ever do anything like once you found out like how like messed up that surgery was? Like, did you ever do anything about it? No.
No, I think I just felt like I just needed to like move on from it and like keep fighting for answers. I recognize that, I mean, bedside manner, like you don't always find it, or like how you need it. And like, I feel like the way I might have perceived like how everything happened, I don't know. I'm not really sure. And I think at that point, like I didn't really have the tools to like be like, oh, I can speak up about this.
Right, right. Was it like at around this time or before then that you were receiving like misdiagnoses?
Well, so yeah, that was, I don't want to say it was like a misdiagnosis, but like
incomplete.
It wasn't complete. Like the whole miserable malalignment thing, you have to look at the entire leg. And what was happening was like doctors were only looking at the joint that I was saying hurt. So, I mean, so when I say like misdiagnosis though, like it's because like that wasn't the full picture. And I don't know if I would have needed, like, I don't think I would have needed those first 3 surgeries.
Yeah.
Like if I was just diagnosed with miserable malalignment to begin with.
Yeah.
However, I do want to share that like it is kind of rare. So like not every orthopedic surgeon knows what that is or like understands the impact of it because you don't like see it that often.
Right.
So, I like sometimes I kind of want to be like, those surgeons like did me wrong, but like they didn't know.
Right. Yeah. That's like a common problem with a lot of rare diseases, and it's unfortunate when doctors like perform unnecessary procedures. Yeah.
Right.
I mean, it's like it's all good natured, I guess, but it's just unfortunate. Yeah.
Definitely.
So having these like multiple surgeries, I'm guessing like, I mean, at that time you mentioned that you were like, like stressed about your boards, about the plan and everything. How did like, I'm guessing you were like under a little like mental duress, like stress. So finally receiving your MMS diagnosed, like how did that make you feel? Like what changed at that point?
I finally felt like I was seen, and like not just like as a joint, but like as a whole person, and like to finally have a name of something that I had been experiencing for my entire life. And like I very overwhelmed. Like
right.
I can't even describe like how I felt after that, because I mean, like I finally had an answer.
Right. Yeah.
Years. But then also like really sad, like very sad that 1, I had suffered for so long, and 2, everything that was ahead of me. Like it wasn't a simple like 1 surgery, let's just fix it. It's been multiple really painful surgeries.
Right. Yeah. Yeah, like you had clarity at this point, but like, it's still so overwhelming to learn about this. Yeah. How did your mental and physical recovery look from this point on forward?
Well, physically, I guess I'll share a little bit about like what the procedure is to give like some background, as to how I was affected physically. The procedures to fix the bones involve breaking the bones and then rotating them so the bones are straight. So the first one that I had, the miserable malalignment surgery that I had, was a femoral osteotomy. So they broke my femur, and it was a painful one for sure.
Yeah.
I mean, having a broken femur, like you feel like you can't do anything, and it sucks. It really does. And so not long after that surgery, mentally, I was not in a good place at all. I feel like I totally like gave up on life, gave up on my recovery. I just like didn't care about anything anymore. And I definitely felt like I hit bottom. But at one point, I actually go to therapy, and that's been so helpful for me. I went to therapy and, had a very honest conversation, about what I was going through and like what I needed to do to change, especially because I had multiple surgeries ahead of me that involved very similar, like bone breaking surgery, right?
Right.
So by the time, like 8 months after the femur one, I had the tibia fixed, and I felt like at that point, like I definitely had like much better, like I had better tools to help me like get through that time. But like I still find myself like going through ups and downs, like times when I just like sit here and like, what am I doing? Like, it's really hard to like feel like you're not where you want to be. But also like accepting like, okay, this is where I'm at, and like this is what I'm going to do that like it is meaningful to me, and also kind of using like what I'm going through, to help other people and to like learn about myself and like grow from these experiences. So I feel like it's mentally, it's definitely a roller coaster. Like there's ups and there's downs, and and physically it's still very hard, because like right now I'm from like my left side, like I had my right side completely straight now at this point. My left side, I'm actually sitting here with a broken femur. So like I've had that done, but I'm like half aligned, and that feels weird, like have, instead of one just completely crooked leg, it's like half done, and it definitely is not fun physically.
Probably not mentally either, because I mean, just like hearing you talk about it, like when you say like the surgeries had to break your bones, like it's very it's very graphic, and like if I were on the receiving end, like I don't think that I would like be mentally okay with that. And then like as you mentioned, like one side is aligned, one side isn't. Like, is it well, I don't want to get too into it, but like I guess just like the visual of that is like, I can see how that would be like mentally deprecating.
Sure. Yeah, I think so. What happens is like when you straighten one bone, like the other bone kind of like shifts too. So like because my femur went like inwards and my tibia went out, when you straighten the femur, the tibia like goes even more out. So it definitely visually it did get a lot worse. Like my foot just goes like way out to the side now.
Did this physical disability impact your career, the way you were able to work?
Yeah, I mean, initially the first like 3 surgeries that I had, they were a lot easier to recover from. So it was like I'd be out for a few weeks and then I was able to come back. And then my miserable malalignment surgeries happened in 2021. So like not long after, the COVID pandemic started. So like I was fortunate enough to like be able to like do some online work. But, now like I'm at the point where it's not really reasonable for me to like go in at this point, because I still have a broken femur, still have to use my mobility aids, like I use crutches, I have a wheelchair, like and I have a very physically demanding job, so it's not that reasonable at this point. And then I also like I have things with my wrists and stuff, so it's like working, I miss it a lot. I really, really do. And I'm trying to make the best of this time though, and just kind of like, reflecting on, why I like occupational therapy and how I can like use what I have learned through it to help myself and also to help other people.
Yeah, I think it's really great that you found a career that like eventually, whether you knew it or not, ended up helping you in the long run. I think that's really beneficial, because at least you have like some perspective of what's going on. You have some idea of what's to be expected. Like you're not going into it with zero knowledge, just blindsided. So
right.
Yeah, I mean, and working in healthcare, I guess at first you weren't able to advocate for yourself, but working in healthcare yourself, I'm sure that that helped you kind of communicate with the physicians and yeah.
Definitely. Yeah, I think that like I can communicate with them differently. Like because I know my anatomy so well. It's like, hey, I know exactly what's hurting. Like I can tell you the name of the
Right, yeah.
the tendon or the bone or whatever.
That's really impressive, and I think like definitely helps everyone.
Sure. Yeah.
Yeah. So for someone who might be going through like something similar, like maybe they don't have like the same background you have, but they are going through similar things, like what advice would you give them that might help them like advocate for themselves the way you did, or just get through in general?
That's a really good question. I think I would say, first of all, like, do your research. Like, I'm just trying to think back to, when I was first like starting to go through all this. I wish I would have done more research about,
Absolutely.
the surgeon that I chose, for the first one. And just making sure that they have like the experience, but also like knowing that like just because like you consult with a surgeon doesn't mean that you have to go with that surgeon,
Right.
like you can like break up with that surgeon or what, if somebody isn't working for you, it's not a bad thing. It's a good thing. Like you can kind of find someone or some course of treatment or whatever it is that like works for you, that you feel comfortable with. I think
Like you're the one who's going through it. You're the one who's going to be paying hundreds of thousands of dollars paying this off. So you might as well find a treatment that works for you. Yeah.
Right. Yeah. I mean, and the same goes with like, occupational therapists or physical therapists. If it's not, if it doesn't really align with what like you want, like you don't have to stay in that situation, and like we're not going to be offended. And I'm speaking from, an occupational therapist standpoint too. Like, we want like, no matter, like, we want you to get better. Any healthcare professional, like, we want you to get better, and whatever that takes, like, do it.
Yeah, absolutely. In terms of like mental health and mental recovery, what advice would you give in that sector?
Well, okay, so a big thing that I have been dealing with is like finding meaning in my day, because after so many surgeries, it gets old just sitting here like feeling like you're not doing the things that you want to be doing. But like really taking the time to be like, okay, what is it that I want to do with this time? And like, what is it that's the most meaningful for me? I think that was where like I really struggled with the first MMS surgery. Like I didn't really find things to like do in my day that like meant anything. Like I just felt like I was sitting there doing nothing. Like I mean, my body was clearly like healing a broken leg. Like that's a full-time job in itself. But just like really what is it that makes me feel like like a purpose? Yeah. So I ended up like starting to write a lot. I've always liked to write, but like I think that I was given this time like I like to think of it this way, I was given this time to like really write like what it is I want to write. So I started writing a book. I like to write poetry. I'm learning a third language, like trying to do the things that like I don't think I would have ever had time for before.
Making the best of a bad situation. Yeah.
Right. Yeah, exactly.
Yeah.
So definitely find meaning in your day-to-day, in your year and your life. What you find that meaningful, activity or activities, and do it.
And you mentioned you do therapy. Did that like help you a lot?
Oh yeah. It helps me so much. Yeah, it certainly has. I think like anybody with chronic pain like knows just how hard it is, like, day in and day out to deal with that and all of the things that it brings up mentally. And therapy has definitely helped me, navigate that a little bit. And one of the biggest things I feel like I've learned in therapy is like, it's okay to feel your feelings. Like, this is terrible right now. Like, I wouldn't ask these broken bones on anybody. Like, I really wouldn't wish that on anyone. But, you know, I'm here, I'm dealing with it. I'm going to feel those really terrible feelings, but then I'm also going to be like, okay, like now, like once those feelings pass, I'm going to move on from it. I'm not going to hit bottom again. I feel like I have more confidence in like facing the day, because it's hard. It really is hard when you have a constant reminder of the pain that you experience.
Right. Just out of curiosity, like you've had like, are you gonna have more surgeries to correct the tibia? And then after that, is it like, unless there's like a recurrence, you're like, I don't want to say healed, of course, but like it's fixed almost? And then at that point you would just have like, is chronic pain like still a factor in that, or is it just kind of like,
well, no, that's a really good question. So yes, like I do have the tibia to go. After that, I will have 2 more surgeries to take out the hardware. So I have like a big plate and screws in my femur currently, and then after the tibia, like I'll have the same. So the hardware will come out for that, and then I might have to have another surgery to fix the like the inside of my hip joint, because I'm pretty sure that I have another torn labrum, because the labrum keeps re-tearing if like your whole leg isn't in alignment. So I might have to have another surgery for that as well. And I had the same thing happen with my right leg, where I like had all the hardware taken out, realized that like my hip joint was still pretty bad, had to go in and have another surgery. I can say though with confidence that like with my right leg, I don't have pain anymore.
Okay, yeah. Okay.
So that's like so exciting that like it's very hopeful that like once I get through this with my left leg, that I will experience the same thing. Like I will be pain-free in my legs for the first time and you know, I don't know how long since I could remember, you know?
Yeah.
So I probably have another like 4 surgeries on my legs.
Well, that's awesome that you're gonna be like, after all these years, then you'll be able to get back to, you know, working, doing everything. That's awesome.
Right. No, and that's another thing is like, okay, going back to also like finding somebody, like finding a surgeon that like works best for you. I have started to realize how important it is to like find a surgeon that is like his goals are in alignment with your goals. Like, so my goal through all of this is to get back to running again. Like that has been my absolute favorite thing ever. My greatest coping mechanism was running, and that is his goal too. Like in every appointment, like he kind of like tells me like, okay, like we're gonna get you back. Like that's our goal through all of this, and like it just feels good that like, you know, my goal is his goal now too.
Yeah.
So yeah, I think that's another important part about like finding the right surgeon.
Absolutely. I actually just got like an alert that it's like running out of time. So but sorry, I was just like, I want to hear so much more, but don't want it to shut off midway. So thank you so much again for speaking with me. This was actually very interesting. I'm really interested about the surgeries that you went through, and I think I'm gonna like look a little into that, because the way you described it, obviously it's very graphic, but I just want to,
I know.
It's
very graphic.
It's really interesting, and I really hope that you're able to get back into running, because you mentioned that you were a very like committed athlete before this, so like to see it kind of go full circle, that would be just like awesome, I think.
And if you ever want to know about a different diagnosis, I got another diagnosis for you.
for the ulna.
Yeah.
Right. I was gonna mention that, but then I just got too deep into the fever. So
it's the miserable malalignment one is definitely the very intense one. The one that you won't hear about very often.
Is yeah. Well, honestly, if it comes to it, I would love to, you know, talk again about because that was I would love to talk again. But right now I think that's all we can get through. Yeah. So again, it was great to speak to you. Thank you so much for joining me today. And you know, I hope you enjoyed speaking with me, and hope you have a great day.
You too. Thanks so much.
All right. Have a good one.
You too.